You want to make it taller, sometimes we use your own rib.
If we are talking about micro surgeries, what will be the starting cost like generally?
Double eyelid, facelift, things can range from like say 10,000 to 50,000, 60,000 ringgit. I've seen a lot of cases their nose is in really, really bad condition. Because these are cosmetic surgeries, this is gonna cost you a lot of money, and insurance is not gonna cover all this for you.
Alright everyone, welcome back to another episode of Mr. Money TV, and this episode we are gonna talk about plastic surgery, right? Yeah, because these days we are seeing more and more people going into plastic surgery, and there's a lot of questions surrounding it, from how can I approach the topic of plastic surgery to how much does it really cost, and does it bring in any form of monetary investment or ROI from it. So today, regarding this topic, we brought once again Dr. James to the studio. Hello, Dr. James.
Hi.
So last time we talked about career as a doctor. This time we get you in here to talk about plastic surgery, right? And people are probably wondering, aren't you the ENT guy? What has ENT got to do with plastic surgery? You want to share with us a little bit?
So I'm an ENT surgeon. At the same time, I also do a lot of rhinoplasty surgery.
Okay.
So rhinoplasty surgery is commonly known as a nose job. Most people relate nose job as cosmetic surgery, which in somewhat is true. A lot of patients choose to do a rhinoplasty to enhance their looks.
Right.
But
the key thing you said, somewhat.
Yes, because I also do a lot of rhinoplasty surgeries to help patients breathe better.
Oh.
So, for example, a patient has an accident, has a broken nose, so, the nose is crooked. So that would affect his breathing. Because you can imagine the nose being blocked on one side, for example. So these patients would need a rhinoplasty surgery to help them breathe better.
Right.
So that we call it a functional rhinoplasty.
Oh, but since I'm gonna fix it, so I fix it even nicer lah.
So I do offer that option to patients sometimes.
But then that wouldn't be claimable by insurance, right?
No, so that is usually, you will have to pay out of the pocket because that's a cosmetic surgery. There's another type of rhinoplasty, which is the cosmetic rhinoplasty, which most patients are more familiar with. These are, common things like a higher nose, a smaller nose, a more defined.
Yeah. Like nowadays, I see a lot of Malaysian girls. Their nose look like Korean like that.
Right.
Those like the tin, then like that higher. The one is rhinoplasty one, right?
Right. Those are rhinoplasty surgeries.
I think generally they made it more.
We will say more refined.
More refined.
Like an enhanced nose.
And then at the same time, does it mean that they can breathe better as well because of that?
Well, that sometimes come with a flip side. So sometimes when patients do a rhinoplasty, a cosmetic rhinoplasty, sometimes that can affect their breathing if they are not being done by a surgeon, somebody who is specialized in rhinoplasty. We have this saying in rhinoplasty that the form and function goes together. If you enhance the form but you don't think about the function, that can be affected. So you may look really nice, you may have a really nice nose, but you may not be able to breathe through that nose. That's not something you would want, right? So it is it goes together. So oftentimes when I do cosmetic rhinoplasties, I will also always think about the function. Can this patient breathe better after that?
And we can say that because you are an ENT specialist yourself, that kind of gives you the base about the function first.
Right. So as an ENT, we were trained to address the function first, then went for further training for the cosmetic part.
Right.
Yeah.
So you were mentioning that there are certain doctors who actually perform rhinoplasty, but they are actually not ENT surgeon or surgeon per se. So does it mean that any doctors who actually go for somewhat of an external course can actually start performing rhinoplasty?
So there's two types of rhinoplasty as well. One we call non-surgical rhinoplasties, and one is surgical rhinoplasties. So the non-surgical rhinoplasties are the ones that commonly done in the aesthetic clinics, such as injecting fillers. So when you inject fillers on the nose, it can increase the volume of the nose, so to increase the height of the nose. A lot of camouflaging, giving more refined looks. Yeah. So those are called non-surgical rhinoplasties.
And those won't be permanent, right?
Tend to sort of last for a year, maybe more.
Right.
Yeah. So those are fillers and threads. I think a lot of people have probably would have heard of that.
Right.
So
what's threads?
Threads. So they put like threads, like little pieces of silicone or other material that they sort of put it under your skin and
Right, just to make it look higher.
right, the more threads you put, the higher your nose will be.
Right,
So that's all this non-surgical rhinoplasty. And then you have the surgical rhinoplasty, which I specialize in,
Right.
So just now you were asking who does rhinoplasty surgery. I think generally two specialties. One is the plastic surgeons, and the other ones are the ENT surgeons. Yeah.
Right. Before we go into how the procedure is like and what are the different kind of cosmetic surgery are we talking about, let's start by a very simple thing, right? Generally, when we talk about cosmetic surgery currently, I'm starting to see more and more beauty clinics appearing. Like literally one square, you have 3 or 4 these days. And more people are doing it. It's very normal. Doing the double eyelid and then some fillers. Those are the most common ones that we see. Now, for yourself, because you see in a rather more specialized one, but you are still aware of the overall market, do you think that there are also more and more males who are starting to approach plastic surgery or beauty surgeries? Because these days, I do see quite a lot of guys suddenly got double eyelid out of the blue. Right? Or suddenly nicer nose.
Yes.
Yeah, it looks like it's no more just a female thing these days. What do you see as the market and the pattern these days?
I think there's a growing number of males doing cosmetic surgeries to their face as well. Like just now you mentioned double eyelids, chin lifting, face lifts, rhinoplasties. Generally, I think the majority are still females, but there's an increasing number of males doing plastic surgeries as well. Yeah.
Okay. So say out of 10 patients doing rhino these days, how many are male?
I would say for cosmetic, probably 80 to 90% are still females. For functional, then more males, because I think males tend to have more injuries to their nose. So
basketball or something like that, right?
Basketball is actually a very common sport that result in a broken
MMA?
nose.
What about like fights?
Yes, nowadays we are seeing the growing popularity in physical, what do you call that? Combat sports. Yeah. So MMA, boxing, judo.
So I know I got this ear problem. What they call cauliflower
Cauliflower,
ear. So this is no surgery, right?
You have to sort of treat it in the early stage when there's a swelling. So you have to sort of take up that.
When I had that time, right, I bought syringe and I poked myself to extract out the
fluid.
The fluid. Because I actually went to a clinic and the clinic didn't know how to do it. And they were quite afraid because it was still 6 years back. 6 years back. The time combat sport still not super popular yet.
Right.
So then the clinic was like, no man, I'm not gonna do that for you. Then I just went buy a syringe and pull it out myself. That was scary lah. Anyway, nothing about my ear today. It's more about plastic surgery. So let's start talking about the cost a little bit, right? If we are talking about micro surgeries, right? What will be the starting cost like generally? I define it as micro because it's not too invasive, double eyelids.
I would say also depends on who does it.
Okay.
So I think the more experienced and the more renowned the surgeon or the doctor is, the higher they can charge. Like a rhinoplasty, for example. I know some surgeons in the West, those real renowned ones, are charging maybe $50,000 for a rhinoplasty.
$50,000.
Right. So
that's a 200,000 nose, man.
Right, that's a 200,000 nose.
Wow, that's the price of a Tesla.
right, for rhinoplasty. But you would be surprised there are a huge queue for the surgeons like that. So
Yeah.
they are all booked up for a year or two, maybe more.
Wow.
I think Malaysia, it's probably between 10 to 30,000 or so.
That's a cosmetic
for
rhino lah.
cosmetic rhinoplasty.
Functional will be different, right? Because
Well, functional
Is it-
usually covered by insurance due to injury, for example. So you had to fix it to help the patient breathe better. So usually it's covered by insurance.
is it also because like it depends on the level of injury, how much I need to fix, so it's a little bit different.
So unfortunately, we only have one code for rhinoplasty.
Oh, okay.
So we doctors, when we do perform surgeries, we have to follow the code. That means there's a fixed pricing. We can't go beyond a certain limit. For example, a functional rhinoplasty, however complex or however simple it is still the same price.
Right.
Right.
Understood.
It's very low if you
Right.
ask me as a rhinoplasty. So
Right.
yeah.
Understood. So now we are saying that actually when it comes to cosmetic surgery, there is no regulation that defines how much you should be charging, is it?
Right, because cosmetic surgery doesn't come under a code. It's up to the surgeon to charge. And it's
Okay.
more like a buyer-seller sort of thing agreement. Like, the surgeon says 50,000, the patient agrees 50,000.
Right.
So that will be the cost of the
Right,
surgery.
right.
Yeah.
Let's move on to the next part of this. Is that nowadays more and more people are doing plastic surgery as we know it, and rhinoplasty definitely is one of the very, very common ones that I'm
Right,
seeing,
right.
because like I mentioned the other day, I was having a dinner with my wife.
Mm-hmm.
I saw this couple that came in with the kids. Obviously the mother looked extremely Korean-ish. The kids have nothing like Korean
Right,
nose
right,
look,
right.
but the mother has a full. I can breathe or not, I do not know lah. But the nose is a Korean nose as
Yeah,
far as I'm
yeah,
concerned.
yeah.
I literally thought she was a Korean, right? Until she opened her mouth. She either grew up in Malaysia or something like that, but definitely doesn't sound Korean
Right,
to me.
right.
We know that in certain other countries like Korea, it is very common for people to do plastic surgery because it's also an issue about getting a job and stuff like that. There's really this discrimination when you don't look that pretty in Korea.
Right.
Malaysia, we are not that yet. But I understand also there are plenty of studies that actually talks about how beauty will actually bring in certain ROIs. Since you being a doctor and you actually do perform a rhinoplasty, do you really see some of your patients after performing the rhinoplasty a certain years later, they do generally earn more? And what are some of these studies that you have read before that supports it? So we'll say the studies lah. So that one already got evidence based, right? Then the other one we'll consider as bias, okay? Yeah, because it's your experience, and I bet people down there will also say because you perform, right?
Right.
Yeah, but in your observation, in the most genuine manner lah.
Cosmetic surgery on, in this case, rhinoplasty, for example, I think it tends to improve a person's self-confidence. That is something I do see in my patients. So after, I've done the rhinoplasty, they feel happier, they feel more confident.
Wow, so the talk also very different.
Right. So, before that, sometimes they are self-conscious. They would think that I have a small flat nose. What do people think about me? Now that I have a more nicer nose, then I have
Talk also louder.
more confidence. Yes, I do see that.
Wow,
They
wow.
talk more confidently. So I have patients who say I'm very embarrassed to take selfies before this. Now you can see from their social media.
Wow.
So I think that in turn may translate to being confident to get a job, a new job, change careers. Probably, I would say.
Very good, very
that,
good. You're
yeah,
trying not to
yeah.
be biased at all. Yeah.
Right.
So fair enough. I think yes, when someone is much more confident with their look, they are able to speak up better, and therefore opportunities tend to come their way because they just tend to stand out more.
Yeah,
right?
yeah, I would think so.
Yeah.
Yes.
Yeah. In that case, if let's say just by doing a $10,000 nose job allows me to close a 30,000 contract, maybe I should consider a nose job. No, okay, jokes. Those are jokes, right? We're not recommending any medical procedure.
Right. Yeah.
Jokes aside, right? Now, so actually, I did read some research there was research that says that people who are prettier tend to earn more. People who are more handsome also tend to earn more. In fact, taller people tend to earn more. People with better proportion, like longer legs, also tend to earn more. There are plenty of studies that talks about this, right?
Right.
And what are some of the most prominent studies that you've came across that made you like, wow, I never thought about that, or like, wow, that's quite surprising?
So I think we've read a lot about that on the internet, and then I think there's a lot of studies that you mentioned have to show that beautiful people tend to earn more. I think that's in a way somewhat true. That's why we tend to gravitate to people like celebrities and who usually do look more beautiful, more handsome. For example, I'll give you an example like now on top of my head I can think about is Cristiano Ronaldo. Yeah, I mean he has the skill. A lot of other footballers, maybe not as good as him, but similar skills. But because he is good looking, so he gets more endorsement. He's more popular. More people follow him on social media.
In fact, he did quite some work as well. Yeah, his teeth wasn't like that. If you look at his older pictures.
And because he did that, he got more endorsements.
Yeah, he got more endorsements, right? Yeah, okay, fair. True. Everyone is beautiful.
Right.
Everyone is beautiful in their own sense. We are talking about market and everything. Okay. So please don't take this as like personal or anything. If anyone is trying to approach this subject of plastic surgery, now we are not talking about those micro like Botox injection. I think that one's still quite common, quite easy. If someone is looking at doing a rhinoplasty per se, because that's one of the most entry level plastic surgery that most people will approach first before you talk about any other things. Right. What are some of the considerations that they need to have? Like, how do I go about? Do I just say like, I want a pretty nose, then I come and see a doctor? Or should I look at Pinterest, sample some nose? Or what do we do?
Generally, when patients come to see me for a cosmetic rhinoplasty, they would have some image and some idea what they want. Sometimes could be just tell me that they just want their nose a little bit higher. They don't want people to see their nostrils so easily. So sometimes it's just more specific what they want to enhance. Sometimes some patients do, bring pictures.
I want to look like Rosé.
Like
I want to look like Angelina Jolie.
Yes. So actually, that is sometimes quite difficult for the surgeon to achieve. Because a lot of times we also need to manage expectations. And for example, an Angelina Jolie's nose might not look nice on you.
Right. So you're gonna like the person bring you like the picture of Angelina Jolie and say, I want to look like this. Then you're like, I'm sorry, your problem is not rhino alone. It's the whole way.
But your face is like this, probably this might not look good on you. So there's a lot of discussions that goes on during a consultation.
I think it would be quite common, right? That people come to you with a Korean star or something and then say, I want to look like this. And then you're like actually may not suit because there's a lot more jobs involved if you really want to.
Yeah, so a true rhinoplasty consult can take a long time because sometimes patients might not realize certain things. For example, sometimes I tell them, yes, you look nice with this nose in your 20s. But have you ever imagined when you're in your 40s, you may want to consider doing revision? Like it's so tall, I'm 40, it doesn't look so nice. So there's a lot of things that you sometimes, as a doctor, you tell patients.
Right.
There are a lot of doctors that also morph pictures. So they come in, they have this computer software that you can sort of show them what before and after surgery looks like. You can sort of make it higher, shorter, more rotated, derotated.
Wow. So you have a software like that to show people?
I do have a very basic one that sometimes some patients would ask, they would want to see roughly how I look like after the surgery. I do show them like, this is how you probably look like.
Right.
Yeah. And we would tell them, maybe about 70-80% similar. We don't want to promise 100%. So as close as this picture it is, something like that. Yeah.
So usually how long would a consultation take and before to the surgery and then post-surgery what we're looking at?
Ideally, I think a cosmetic consultation sometimes can take, say, half an hour. So it does take a lot of time. Yeah.
Right. So how many times do I need to see you before I...
Generally, we would like to see a patient at least 2 to 3 times before we even start. We even plan to do the surgery. Sometimes we do have what we call a cooling off period. So we explain everything to the patient. This is what we do. And you'll go back and think about it.
Think about it. Make sure they really want it.
Right.
Because it's not like buy veggie, right? Can return.
Right.
Yeah.
Because it is a surgery that both parties would need to agree upon, that it is achievable.
Right.
And that we would only prefer to do it once.
Well, you said once. Means that, are there people who actually do it, then they were like, actually, doctor, I prefer my own nose.
Like, I get a lot of inquiries. Sometimes they said, I did this rhinoplasty with this doctor. 1 week later, they say, I just don't like it. It's too tall. Can I just change it? So probably because maybe the doctor before the surgery did not spend enough time to explain that to the patient. Rhinoplasty can be very simple as well. It can be very complex. So a simple rhinoplasty would be, just put an incision on the nose, tunnel through under the skin and put a silicone implant under the skin.
Okay.
That's what we call a very simple rhinoplasty.
Simple. Well, what's a complicated rhino?
A complex, you open up the nose, you align the cartilage. Sometimes
open up the nose, realign the cartilage.
Remove some cartilage. Sometimes even you want to make it taller. Sometimes we use your own rib so that we can get enough volume of cartilage to, use it as a graft, what we call a graft to,
So you graft a rib.
Right. Your own rib.
So it means I need to cut a small part of my rib.
Yeah, so usually you take about a 2 to 3 centimeter block of your rib.
That's a lot of my rib.
Right.
That's not very little.
So imagine sometimes if you have a very flat nose and you want a really tall nose, you will need a volume of cartilage. And where are you going to get that volume of cartilage? So you either get it from a synthetic material like silicone or Gore-Tex, or preferably your own cartilage, which is less chance of rejection, infection. If you are talking about that kind of rhinoplasty, you can imagine it is much more complex, much more difficult, and takes much longer. It can take up to 4 to 5 hours for one surgery. 4 to 5. 4 to 5.
Wow.
Yeah.
And that is the most complex, is to take out my own rib and...
Right.
Like, what's the benefit of that aside from rejection? Does it last longer? Does it more natural, or...?
It gives a more softer appearance. So it's more natural.
Oh, got difference one, really? Like...
Yeah, okay. So, for example, usually silicone rhinoplasties is you see somebody, you definitely know she had a nose job, whereas a more softer look would be like, she looks a little bit different, but I'm not very sure what did she do to her nose.
I can imagine why people pay so much for... Yeah, just that sentence itself, if I'm going to be doing it, I will take out my own...
Yeah, so sometimes we do ask patients like, do you want people to say that, you did a really nice rhinoplasty? Or,
you just look better suddenly.
Yeah, you look different. Did you go for surgery? Yeah. So I think the trend has moved to that as well. It used to be everybody liked that tall silicone nose.
Nowadays it's very natural.
Trends change over time as well. I think now people prefer a more natural look. Usually I advise patients, if you're going to do it, you better get a well-qualified surgeon to deal with in case there's any problems that doctor can treat it. Why?
Right.
Because I've seen a lot of cases where they come to me, their nose is in really, really bad condition. And because these are cosmetic surgeries, so you can imagine they don't cover under insurance.
So they went to it gone wrong basically just gone wrong
botch job we call it a botch nose job. You have to admit to the hospital, you have to do a revision surgery. This is gonna cost you a lot of money, and insurance is not gonna cover all this for you. So
you need to do the revision first, only you have to rebuild. So it's double surgery, right?
So sometimes you may have to, take out the infected silicone implant, for example. You have to wash the nose. If you can rebuild the nose on the same time you do it, sometimes you may have to wait for the infection to settle. When there's nothing wrong, nothing goes wrong, that's fine. Yeah, but you also always think that what if things goes wrong? What do I do? Where do I go? So I think that's something important for everyone who's thinking about doing a cosmetic surgery, to go to a well-qualified doctor. And if things goes wrong, we never hope things go wrong, but sometimes
do go wrong.
Yeah, do go wrong.
I myself, because I have tattoos,
right,
so
right.
I totally understand it. Although it's not a surgery, but we have this thing also. Sometimes you see people going to cheap tattoo artists.
Right.
And then you see the quality is very different. So I always tell myself this thing: tattoo is on my skin for a very long time. I better go for a good one.
Right.
I'd rather pay more than having something where I look at it, I'm like, oh, so ugly. Yeah, because later when you do a cover up, it's gonna be more expensive and it's gonna be more tougher as well. Right. So I totally think that anyone, if you're thinking about plastic surgeries, please go for a qualified doctor. Please go for someone who can really, at least nothing goes wrong. And there's always that 0.1 chance, right? Yeah. So I think 0.1 chance is always life and death.
Yes.
Because you're cutting yourself open, right? So better be very careful. Before you go, what is one advice that you have for our audience if they are ever thinking about doing plastic surgery? Yeah, how much should they prepare? And also, how should they start?
First of all, you probably want to do a little bit of research on the doctor who will be, you are thinking of going ahead to do the surgery with.
So what do I do? Do I just Google a plastic surgery?
Well, you can do a Google, do a background search on the surgeon. What is his qualification? Is he a certified, specialist? Does he have the right qualifications? Does he have the experience to do this surgery? Does he have any experience with, maybe can be honest with the doctor, do you have any cases that didn't turn up so well? What did you do? Things like that. Have an honest discussion with the doctor. Do your own research. I would say that's
about it.
That's and I think it's also good to get second opinions. I think you're gonna go for like a life-changing sort of surgery. Even any surgery for that matter, I think it's good to get a second or third opinion. And then don't rush to it. I know sometimes certain patients, they are like, so eager to do the surgery and then they sort of rush through it. You have to think through it a little bit, give it a little bit of cooling period. Sometimes you think like, you wake up one day and say, I look in the mirror and say, I need a nicer nose. But, 3 weeks later, you might think, hey, maybe my nose is really not that bad. I, as a surgeon, also usually tell patients, go back and think about it first. This is what we can do. This is what we can achieve. But, you might not want to do this later. Go back and think about it first. Yeah, talk to your friends, your family, get a second opinion. That's fine. Yeah.
Right. And usually how much do they prepare for this whole process? Like how much should they at least save up for this?
I think depend on what you're doing. Like double eyelid, facelift, things can range from like say 10,000 to 50,000, 60,000 ringgit.
Right.
Don't only think about the surgery. Also sometimes you need to think about what if things go wrong. You may need something to fall back on. Of course, no surgeons ever wish for any complications, but they do sometimes happen. So you might think these are the things that you might want to consider as well. Yeah.
Okay. So thank you very much, Dr. James, for sharing with us all about plastic surgery, especially in the area of rhino. Yeah, for those of you who are thinking about doing a nose job, right? It's up to you. I think you're beautiful as you are, just to put that out there.
Yes.
But maybe you can leave a comment if you think I should do a nose job, right? So thank you very much, everyone, for watching this, and thank you, Dr. James.
You're welcome. Thank you, everyone.